COVID-19 pandemic has impacted our nation drastically, with the second wave cutting a wide swathe of distress across communities. Medical infrastructure across states has been stretched to its limits while dealing with this unprecedented, once-in-a-century health crisis. Under the able leadership of Shri B.S. Yediyurappa, Honorable Chief Minister, the Government of Karnataka has been proactive in setting up processes to contain the spread of the pandemic. Recently, on 19th May, Chief Minister B.S. Yediyurappa announced a relief package of over 1,250 crore rupees for those whose livelihoods have been affected by the COVID-19 induced disruptions. The government of Karnataka also took the lead in announcing a mitigatory economic relief package during the first wave last year. Besides other requirements, the raging pandemic calls for seamless synergy and collaboration between the government and private sectors in their collective goal to provide support to communities across various segments of society. In line with this and to support the Government of India in its fight against COVID-19, Shri Anil Agarwal, Chairman of Vedanta Resources, rolled out 10 Vedanta Cares COVID hospitals across the country to supplement the stretched medical infrastructure by adding 1,000 hospital beds.
I have asked all our unit around that area, work with the collector and the local administration to support these needy people. Wherever there is a health care, they are doing a separate coronavirus unit to support the patient.
Out of the 10 COVID field hospitals committed to be set up in Delhi NCR, Chhattisgarh, Rajasthan, Karnataka, Odisha, Jharkhand and Tamil Nadu, Karnataka is the only state where 2 such hospitals are being established, one each at Chitradurga and Hubli. The best-in-class COVID field hospital at Chitradurga is a fully equipped 100-bedded setup for COVID care with 88 beds with oxygen support and 12 beds with ventilator support for critical patients. The facility is fully air-conditioned with filtration of exhaust for clean airflow. The total treatment area of the hospital is spread over 15,000 square feet and will prove to be a lifeline for the community in this remote region. The hospital has state-of-the-art facilities incorporating major critical care equipment such as ventilators, ABG, ECG, defibrillator, patient monitoring system, BPAP, mobile X-ray, etc., along with other essential medical devices and facilities with UPS and dedicated power generator. This endeavour is part of Vedanta's continued collaboration with the Government of Karnataka, wherein during the first wave last year, we stood by the community and provided wide-ranging support including essentials, providing ambulance support and augmenting ICU beds and multi-para monitors etc. at the district hospital Chitradurga. Apart from construction of COVID field hospitals, Vedanta is also providing essential medical equipment and oxygen support to various government hospitals across the country. It is evident that the collaboration of Vedanta with the government for fight against COVID-19 will definitely bolster the efforts of the central government and the Government of Karnataka during these unprecedented times. Till then, let us all sincerely follow the COVID-19 protocols by wearing masks, maintaining social distancing and washing hands frequently. Vedanta stands with Desh ke saath, Desh ke liye.